How does ezetimibe lower your cardiovascular risk? Imagine your body as a busy city where cholesterol is like traffic that can cause jams and accidents. Now, think of ezetimibe as a traffic cop that helps clear the roads. This medication works in your small intestine, the part of your gut where food is digested. It blocks a special protein called NPC1L1, which is responsible for moving cholesterol from your food into your bloodstream. When ezetimibe blocks this protein, less cholesterol gets into your blood. Because less cholesterol is entering your bloodstream, your liver gets the message to pull out more cholesterol from your blood to balance things out. The liver does this by increasing the number of LDL receptors on its surface. These receptors act like magnets that grab onto LDL cholesterol, often called bad cholesterol, and remove it from your blood. As a result, your blood levels of LDL cholesterol go down. Lowering LDL cholesterol is important because high levels are linked to a higher chance of heart attacks and strokes. When you take ezetimibe, it helps reduce this risk by lowering the amount of bad cholesterol floating around in your blood. Sometimes, doctors prescribe ezetimibe along with statins, which are medicines that reduce cholesterol production in your liver. When used together, these two drugs can lower LDL cholesterol even more than either one alone. This combination is especially helpful for people who have already had a heart attack or are at high risk for heart disease. Besides lowering LDL cholesterol, ezetimibe can also modestly raise HDL cholesterol, which is known as good cholesterol. It may also lower triglycerides, another type of fat in your blood linked to heart disease. Some studies suggest ezetimibe might even reduce inflammation markers like C-reactive protein, which are associated with heart risk. Ezetimibe is generally safe for long-term use because it does not significantly affect the absorption of fat-soluble vitamins. However, like all medications, it is important to watch for side effects. Liver function and muscle symptoms should be monitored, especially when combined with statins. In summary, ezetimibe lowers your heart risk by blocking cholesterol absorption in your gut, which leads to lower LDL cholesterol levels in your blood. It works well on its own or with other medications to support your heart health and reduce the chances of serious cardiovascular events.